Hi, howdy, welcome back. It's been a minute. If you can't tell by the title of today's video, we're going to talk about diabetes and beauty. And I know if you're not a diabetic, you may not be interested in this, or you may just have questions. I'm just going to talk about it because it is something that has affected me, and it's not something that gets talked about a lot, okay? So if you have any questions, feel free to ask. I'm very open about the topic. I have no problem answering any of those. I'm just going to talk about my personal experience, okay? But first, if this is your first time here, feel free to reach down and hit like. If this is not your first time here, feel free to reach down and hit subscribe, then like, either or, whatever makes you feel comfortable. Okay. So my oldest son is 3. I was not a diabetic before I got pregnant. I went gestational diabetic about halfway through my pregnancy. When I was done having my oldest son, I was reclassified as what's called pre-diabetic, which meant my resting sugars were higher than they should have been. Okay. But my after meal sugars were good. And there were a couple things in between the size of the baby and the way my gestational diabetes went. I was listed as being a high risk for just becoming diabetic, period. Fast forward to 1.5 years later, I get pregnant for a second time. And because I had been gestational diabetic with the first pregnancy, I personally was keeping an eye on my sugars. It was not something my OB had mentioned. She was just going to do the regular glucose test like they do with any pregnancy. They weren't going to really worry about it. But because I was pre-diabetic and because I was on medication for it already to help prevent me from going diabetic, I was watching my sugars. I had a script for watching for the tester strips and the lancets and all that, and it was something I watched. So actually I caught myself, I did not wait for the glucose test, I caught my sugars rising before the doctor did. And I actually turned around and made an appointment with my endocrinologist who deals with diabetes and brought it to her and said, look, this is what I'm finding. So we did an A1C and we checked everything and found that my sugar was rising earlier in my second pregnancy than it did in my first. And I ended up gestational diabetic, a lot more so in the second one, but or should I say, I ended up diabetic earlier in the second pregnancy, but it was better controlled. Had the baby, he didn't end up as big as his brother. He was actually about 1 pound lighter. He came out healthy, both boys dead. Then we did what we did after my last round of being pregnant. We went on medications. We tried to drop everything. I couldn't lose the weight as fast as I did the first time. And my sugars didn't respond the way they did the first time. Now, I was put on a medication called Ozempic. Now, if any of you guys know what Ozempic is a GBL1 antagonist receptor. Basically, there are 3 or 4 hormones that go off in your body when you become diabetic. And Ozempic is designed to address one of those hormones. What it does is it slows down your body's digestive tract and causes your body to digest food slower. It also causes your sugars not to rise as fast after eating and forces your pancreas to work more. Now, that is something like metformin and stuff or insulin does not do. It does not and cannot force your pancreas to work. With Ozempic and the rest of the GBL1 receptor antagonists, they do. They basically force your pancreas to turn on, light up, do your job. Not always to the extent it was before you went diabetic, but to an extent that it can help. Now, one of the side effects of Ozempic is that you lose weight. Now, I'm going to point out, I need to really specify this. The weight loss is a side effect to keeping your sugar under control. Now, when your sugars are out of whack, you start gaining weight. You become what's called insulin resistant, but you start gaining weight because you have more standing sugar in your body. Your body turns around and starts storing that as fat. And it makes it harder to lose weight because once you can't get your sugars down, you can't get them down. And the more fat your body accumulates, the more you start keeping that weight on. And it's like a cycle that you cannot break out of. Now, Ozempic, by slowing down the digestive tracts, reducing the amount you eat, And starting your pancreas back up forces you to lose weight, but it also forces your sugars down. So what its primary purpose is to get your pancreas moving and force your sugars to where they should be. Okay? And the byproduct is weight loss. It's not the intended thing. That's not what they were aiming for when the product was designed. The product was designed to treat diabetes. Okay? Fast forward to this. I went back on Ozempic. Now, if you guys followed my journey with Ozempic the first time, I had a lot of side effects. The first being massive constipation on a level I didn't know was possible. I ended up stopping taking it after my first son. I was put on it after my first son was born, and I stopped taking it about 9 months after that because the side effects were so pronounced. And I was tearing things. I know, it's a lot of information, a lot to share. It is one of the less common side effects, but it is what I experienced. Something else I experienced with Ozempic, and this is not listed in its side effects, but happened both times I took this freaking med. So I took the meds, okay, and it helped my sugars get under control, but this time the Ozempic did not help me lose weight. My weight stayed pretty stable. But it did help my sugars go down, just not enough to be where it should be. So my doctor said, let's try another medication. Now I was doing the Ozempic in conjunction with metformin. She said, there's this new medication out on the market called Mounjaro. Okay, Mounjaro addresses 2 of the hormones related to diabetes, not just 1. So this medication, while it's being a GBL1 antagonist receptor thingy again, slows down your digestive tract, but Ozempic only addresses 1 hormone. Mounjaro addresses 2. And the 2 that Mounjaro addresses, one of which is the same as what's in Ozempic, and this is another. Now, there is no medication on the market that addresses all of the hormones that are related to diabetes. Okay? There's not. Mounjaro is front of the class, brand new. This is the newest in it. And it is actually much healthier to be on something like Mounjaro than it is insulin, because insulin, even though it helps keep your sugar in certain respects in check, also the long-term use and the increased sugars do cause long-term damage to your body. Mounjaro helps keep it down. Now, I've worked my way up to a 7.5 dosage, and that is still in conjunction with metformin. And this is the first time since before I was pregnant with my oldest son that my sugars have been consistently where they should be and in good order. In fact, it's the first time that my sugars are looking like they did before I was pregnant in the first place. And you're thinking, what does this have to do with beauty? Yet again, one of its byproducts is to lose weight. I've lost a little bit of weight, not a lot. My goal is to get to where I was before I was pregnant the second time. Sorry, my contacts are shifting. But it has also helped with my skin. Now, what most people don't realize is when you're diabetic, you have a host of physical symptoms to diabetes that are not necessarily noticed, that are not necessarily associated with diabetes, but are absolutely a byproduct of it. For example, higher rates of acne. You have higher sugars, the bacteria grows and feeds on it. You end up with acne more. You end up broken out more. I mean, you guys had seen my face on the old Heinrichsen. The old Heinrichsen pushed my face into just an absolute frenzy. And the diabetes just cranked that up a notch. So we have things like this and this that I've been getting. But since I've been on the Mounjaro, it is dialed back quite a bit. You're also much more likely to get dry patches and textured patches while you're diabetic. Now, a lot of people think because when you're diabetic, you're hydrated, you're peeing more. Look at you, you're drinking left and right, you're peeing more. No, that's because your kidneys are not processing the sugar properly. So you're not actually hydrated more. Your skin will dry out because your body cannot process all that water. You're not losing water weight. Your body is making you thirsty in an attempt to push the sugar out through your urine, which is not a good thing, by the way, but trying to push the sugar out through your urine. So you're drinking more and your kidneys are pushing it out to pee more, trying to get rid of the urine and the sugar. And it's not doable. The body cannot keep up, but it will affect your skin. It also affects down here. You end up with bigger under eye circles. When you're diabetic, you also end up with a lower, in my case, I ended up with low potassium. And that is common. In fact, potassium goes hand in hand with diabetes. If your potassium's low, it will push your sugars higher because that's something that works together. Now, a lot of people that are listed as pre-diabetics will have low potassium, and the lower your potassium goes, the higher your sugar is. In my case, I've been on the Mounjaro long enough, I started getting leg cramps because I had the minor side effect of minor diarrhea. Pardon the bluntness, but minor. And I emphasize minor. I haven't had like Charlie horses since I was a teenager. Okay? I did all the time then, and then I started taking more potassium when I was done. So I've always run somewhat low on potassium, and during the course of both of my pregnancies, I was actually given liquid potassium because I never seemed to register high enough. It's not something that they looked at after the baby, and it's not something you end up having a lot of problems with. Most people don't. So it's not something they check or test. So I had been on the Mounjaro about 2.5 months, and I started getting these leg cramps so bad I thought I was tearing the musculature. And I told my husband, look, I need potassium. I can't keep up with this on bananas and potatoes, and I was trying with my diet to keep up with it while still keeping my sugar in check. So he went out and got me potassium supplements. And much to my surprise, even though I was on the Mounjaro and the metformin, my sugar was ranking like 98 when I wake up, and the goal is to be 94 or less when your sugar's checked. So I start the potassium, and my sugar drops by 15 points. I'm suddenly in the 80s. I'm like, I didn't realize that potassium was linked to diabetes and insulin production at the time. I just knew I'm having Charlie horses, I'm having really bad leg cramps. I ended up having to look it up. And all I can think is, whoa, my doctor's gonna be surprised by this. Now, another thing that you end up shorted on that seems funny is vitamin D. Diabetic, you end up short on vitamin D. That's one of the first things they test, okay? I end up taking the highest amount of vitamin D you can take, okay? The highest amount you can take before it hits toxic, because it is a fat-based vitamin. I am on the highest amount you can take. And I still don't rank high enough. In fact, in the summer, my doctor's like, look, it's sunny out. Go outside. Spend 20 to 30 minutes a day outside. I understand you like sunscreen and you don't want to burn. She's like, but find a way to get this. And apparently that is something that diabetics have a hard time getting, so is vitamin D. And it doesn't matter how much time you're out in the sun, you're not going to get enough. You will end up needing the prescription to go with it. But that being said, here's the part that comes into beauty. A lot of the medications you're going to get put on if you're a diabetic make you sun sensitive. Metformin is in fact one of them. And some of them mention them, some of them have stopped listing it. It depends on how common knowledge it is and how bad they rank it as a side effect. So my medication does in fact make me sun sensitive. Great! Sun sensitive and needing vitamin D. Goody. That's a sunburn. That is sun damage waiting to happen. And trying to compete with that with sunscreen is something else. I am to the point where I'm about to start seeing a dermatologist just to do a mole and freckle check because of that sun sensitivity. And every summer I end up burning even with sunscreen on because of that sun sensitivity. Okay, so you're going to be more prone if you're diabetic and you're treating it to sunburns, to skin cancer, to sun damage, because it's going to make you that way. It is what it is. I do not take insulin, okay? Between the Mounjaro and the metformin, I don't need insulin, which is a good thing. The longer I can put off needing insulin, the better my kidneys will be, the better my liver will be, the better my brain will be, the better my lungs will be, the better everything in me will be, because it puts off the damage of high sugars, but it's also putting off the damage that can come from insulin as well. And there is a certain amount of damage that can happen, but the use of insulin way outranks the damage. Okay, you don't want to end up going in ketoacidosis and ending up hospitalized because you pass out. And I've actually known someone who barely hit 200, and I mean that is the blood sugar check, barely hit 200, and ended up hospitalized and in a coma for a short time. So other than making you more sun sensitive, it can leave you with dry patches, it can leave you with textured skin, it can leave you with more acne. It will, of course, leaving you needing to pee, Once you can get your sugars under control, the urge to drink everything goes down and the urge to pee all the time goes down, thank God. However, a lot of the most common side effects you have with diabetes medication is diarrhea, okay? Some of them, it is the weight loss. So if you're looking for weight loss, yay, there you go. Hope you don't actually need the medication for weight loss. I hope your sugars are good and it's for weight loss. It's not for diabetes. Like, I hope, because it kind of sucks to, like, that is everybody's compliment is, oh my God, you look so good. You've lost weight. And it's hard to stand there and be like, well, I'm trying to lose weight for my own health and I'm trying to be healthier. But I know a lot of the side effect is from the medication, and it kind of feels like a gut punch some days. Kind of like, see how clear my skin is. It took getting my sugar under a better control to the lowest it's been since before I was pregnant with my son for my skin to clear up. And then doing it in conjunctions with stuff like this. And I've had to really lean on AHA and BHA to really get me where I need to go. Dr. Dennis Grossman's facial stuff is really great for that. The non-soap facial cleanser actually did more for clearing my skin than you would ever understand. It's one of the reasons I started retinol too. I mean, my skin's already sun sensitive, but retinol also will help clear up your skin. It also addresses texture. You are going to be more prone to under eye bags and purple circles while being diabetic, because one of the problems is transporting iron as well, not to mention the sugar increase. So that will always be a thing for me too. And I was told by my doctor that it would probably become more prominent because of the sugar, so I need to keep that under control. And I'm like, okay, yay. I mean, I don't know what else to say at this point. In terms of beauty, a lot of times it will become harder to lose weight, like I said, because of the increased sugar you keep in your body. It is what it is. The best way to tackle this is through medication, through healthy eating, through exercise, and through staying up on this. Now, one other thing that I feel like I need to point out, it is beauty related and diabetes related, is you will not heal from wounds as fast. Okay, if your sugar's in check, there's a good chance you can keep it at normal healing rate. The higher your sugar is, the harder it is to heal wounds. So if you get a wound during anything, if you're one of those people that picks at your skin, it's gonna take more to heal. If you're one of those people that accidentally burned your forehead with a hot iron, not this time, it's gonna take longer to heal. You run an increased risk of infection as well because of the increased sugar, so yay. If you have any questions, feel free to ask. I see a specialist about every 6 weeks to monitor my sugar just because of my age. It's somewhat unusual to be in your 30s and diabetic. I'm not gonna lie. My mother was gotten her first diabetes diagnosis at about this age as well. So it's good it was caught early on me when my mother was diagnosed the first time. She went into a 10-year remission. I say the first time because the first time she was diagnosed, she lost 50, almost 100 pounds. We figured out that she was diabetic because she couldn't stop drinking, she couldn't stop peeing. In my case, mine was absolutely caused by my pregnancies, and in about 2% of all cases with people who are gestational diabetic, only about 2% keep the diabetic part. I'm just one of those lucky 2%. It was something I kind of knew was coming because my mother was diabetic, and my mother is diabetic, and her mother was diabetic, and it definitely runs in the family. But I'm a fairly active woman. I try really hard to keep my weight down. I stay physically fit. Sorry. Most of my adult life, I have had a gym membership and I use it. I have competed in half marathons. I have trained for full marathons. Still ended up diabetic. So it is not necessarily because you're fat. It's not necessarily because you're unfit. On a lot of people, diabetes is because your pancreas just, I don't want to say is defective, but it hits a point it's no longer effective. So keep that in mind if you have anybody that you see is fighting with diabetes or struggling with it. It is not necessarily something that you can stop. It's something that you can treat. And at some point, I'm hoping that they'll find some way of addressing all the hormones that are related to diabetes, so that right now my Mounjaro is a once-a-week injection. And I'd like to do that once a week and just all of them to be the healthiest I can be. 2 little kids. Let me know if you have any questions. I have no problem answering them. Oh, in case anybody's curious, I had a very interesting side effect to Ozempic. This is beauty related. Both times I was on it, I had whatever happening, like the massive constipation and all that. But the side effect that they don't tell you about is hair loss. My hair did not fall out while I was on Ozempic, and both times that I took it, my hair started falling out when I stopped taking it. My hair was not abnormally thick before. It wasn't abnormally thick while I took Ozempic. But when I stopped taking it, I started losing my hair left and right. In fact, I had started to gain this all thinning out and getting way back there when I stopped. It took like 6-8 weeks for my hair to start growing back in. Like, it wasn't a permanent hair loss, but it was a noticeable hair loss to me. Like, there was hair everywhere. In case you stop Ozempic and you're wondering what is going on, that is an underreported side effect of Ozempic. In case you're into beauty and hair, that is a real thing. And I actually had to ask my doctor, and she said, yeah, she knows of it, but I should report it to the FDA, because if it's not listed on the series set and more people get it, they have to actually list it on the potential side effects. Okay, guys, leave some comments down below. Let me know what you think. Let me know if you have any questions. Thanks. Be safe. Remember, get your yearly physicals, guys. Thanks.